Well, while people are joining, can we go to the next couple slides? So folks want to update if you want to update your name in Zoom, is one thing that we will ask you to do with your organization, and pronouns, if you feel comfortable adding those. And then if you, as just a beginning little thing, we'll ask you to add into the chat what you're looking forward to this summer. So what's something that that you're looking forward to? Could be one thing, a lot of things, just to give us an idea. I really love this time of year. It makes me feel like, oh, like I'm emerging out of the darkness. So yeah, farmers market, that's a great one. Absolutely. Let's see, what else have we got here? Fishing, all right. Yes, being outside, driving with the windows down, blasting music, swimming, seeing Beyonce. Oh, Pauline, you might have us beat. Even all the rest of us. Nice. All right, great. Well, we are looking forward to this session. So please, if you have questions come up, or you have comments as we go, please use the chat. We definitely use all of that. Disneyland, Universal Studios, oh, super fun, super fun. Great. Emma, why don't we do next slide and get ourselves started here.
So before we move forward, we just wanted to clarify our objectives for today. So by the end of this session, participants will receive updates from the California Department of Healthcare Services. We'll learn from a fellow ECM provider on how the PDSA process is helping to improve outcomes. We will clarify some pain points along the ECM and CS provider journey, as well as brainstorm some solutions along the journey as well. So this is our agenda. And so we're going to start today with a welcome and some highlights, do some housekeeping, discuss sort of our in-person event that will be coming up, as well as provide those updates from DHCS that I mentioned previously. We'll move into part 2, which will be a PDSA spotlight and journey mapping section. We'll hear from one of your colleagues who's been working on this PDSA cycle. And then we'll talk about journey mapping as a problem-solving tool and how you can use that tool to move forward in this process. And we'll also go over the ECM and CS provider journey map. Moving into part 3, we'll discuss implementation in some breakout sessions to really clarify those pain points and identify solutions. And then we'll close out with next steps and kind of give you a sense of what's coming next. There's some surveys that we want you to look out for and some additional resources as well. And then also there will be a copy of today's deck that is provided in the chat, so you can open that to follow along. And as always, we'll also send that afterwards as well. So get ready to party. We wanted to, again, follow up on the planning of an in-person session. We're really excited about the opportunity for everyone to meet in person, to meet one another. But we really want to hear from you if you have any ideas or suggestions on date and time, location, agenda topics. If there are any specific trainings that you'd really like to see during this session, we'd love to hear from you. So please keep an eye out for an in-person planning survey. Right now, just so that you kind of have it in your minds, we're kind of targeting for an August date, but please keep an eye out for that. And we'd love to hear your feedback on what you'd like to see in that in-person session.
Great, thank you, Eva. And before we wrap up with our administrative stuff, I just wanted to see if we have any partnership folks on the line today. We are hoping to do some solutioning later in the session, and just wanted to see if we have any. Looks like Ashley's here. I'm not sure if we, if you want to like give a shout out or maybe just in the chat. just so that providers on the line know who you are. Really, really grateful for having you here today.
Yeah, hi everybody. Can you hear me okay?
Yes, yeah.
Perfect. Hi everyone. I'm Ashley. I'm a program manager here at the ECM team representing. And I believe Chloe, who is our other ECM program manager, is also on her way.
Wonderful. Awesome. Thank you for being here. Chloe, do you want to introduce yourself? Oh, I think she's still on mute. All right. And we don't have anybody from the community supports partnership group, right? I'm looking at names and I don't think so. Okay.
I don't believe we do today.
Okay. Okay. All right. Well, we will look forward to talking to both of you later in the session. Thank you so much. So we have really exciting news for this group that you may have already heard, but in case you didn't, so DHCS announced last week that they have heard us, that all of the various CPIs around the state, have been uplifting all of the concerns, and as we call them, pain points, the issues, the questions, the places where the processes are maybe sticky. The CPIs have been successfully uplifting that, and DHCS last week reflected back the issues that you see here on the slide with some commitments around clarifications that they're going to bring to policy updates in early July. So they weren't ready to publish, their responses, but they wanted ECM and CS providers and plans to know that they were aware of these sticky spaces in the process and that they were working on, so they have draft solutions and they'll be publishing those in the form of policy updates in early July. So just to kind of give you a flavor, they knew that they're, for example, people were bringing up issues around that there were variations across plans in terms of eligibility criteria, in terms of the referrals and authorizations process. Now, if you're a provider who only works with one plan, that may not really matter, but some of the providers that are working across different counties that have different managed care plans, that can get really tricky for them. Similarly, kind of some, around limitations to the provider network, some inconsistencies around reimbursement, issues with payment or delayed payment. These aren't necessarily things that have been uplifted by our specific CPI, but this is what DHCS was hearing across the state. Of course, one that we know is an issue in the Northeastern region is the low awareness in the community about the benefits. And as we'll hear today, part of that is needing to balance with current provider capacity, and not wanting to have too much, you want to have awareness, but if there's too much awareness and not enough before you build up full provider capacity, then that leads to other concerns as well. So anyway, we won't go into these in detail, but we wanted to give you just a heads up and some validation that all of the issues that you've been bringing up are getting sent up to the state, and on a statewide basis, DHCS has really validated that these are issues they've heard, and that they are, really working at the state level to try to see if there are more systems level changes that, or if not changes, then clarifications that they can offer. And with that, I guess I'll just pause for any questions or any comments on that, on DHCS updates. So we will definitely be spending a good section of our next session in July talking through those, because we want to make sure that this group is really well versed in anything that comes out from the state. All right. So I think we'll keep going then. And so I will pass it off to you.
Thanks, Gabrielle. So we're going to be moving into our PDSA spotlight, where you'll have a chance to hear from one of your colleagues who's going through the PDSA cycle and sort of what that experience has been like for them. We just want to do a really brief recap of where we left off in the PDSA cycle and introduction kind of this concept and how to implement this. So I know that when we left off, there were some participants who were still in that plan phase of the PDSA cycle, and then some were starting to move into the do phase as well. And so today we're going to hear from Samantha Earnshaw, who's the program manager at LSS of Northern California. Samantha, are you here with us? I think I saw your name.
I am.
Hi there. Thank you so much for sharing your experience with us today.
Thank you. So hi, everyone. So just to give you some background, Lutheran Social Services of Northern California is in a few counties. We are in, we extend all the way from Redding down to Concord and across to Stockton, and Sacramento is where down to San Francisco actually, and Sacramento is where the bulk of our programs are. And I operate mainly out of Sacramento. I'm the program manager. I have been a program manager for most of our mainly adult services, and CalAIM programs included in that. We serve, generally the organization, we serve across the board. We serve youth, we serve families, we serve chronically homeless adults, single adults. And so and seniors now is a special population we also serve. So we are kind of like everywhere. For CalAIM, for Shasta and Siskiyou, we focused on homeless adults and those who are at risk of homelessness. That's our population of focus in our counties here. When we started CalAIM, I had come off of, I don't know how many of you had heard of or even knew about the Pathways program, which was the Health and Homes program. And we had come off of that. We had partnered in that in Sacramento. And so we came off that experience being very excited about this collaboration that it kind of formed. We had left all these silos because everything is siloed because it was competitive. As you guys, I'm sure, are well aware, we're always competing for money. So even though we're here for the same purpose, it always feels like this money grab and no one wants to share their ideas because they might lose out on money, you know, kind of thing to do the work we want to do. And so Pathways kind of killed that. And all of a sudden we were talking to partners and we were collaborating around, you know, the population. And it just was just so lovey-dovey not to have to compete, but to actually collaborate to end homelessness. So when CalAIM, when the evolution of CalAIM came along, it was like, yay, the continuation of this kumbaya, we're in this together. And as we started kind of learning more about it, it was like, oh no, we're siloed again. Like, okay, so we do CS and someone else is doing ECM for them and we're not sure who it is. And, you know, those kind of things. So it became this weird, like, disconnected thing again. So when I heard about the collaboratives and we were invited to join the collaboratives, I was like on it. I'm like, okay, there's hope. I get to see other organizations that are doing the work that I can reach out to and talk to, and, you know, and because we're in so many different counties, I'm a part of a number of collaborations, but I'm very excited to be part of the collaboration because I get to see and connect with people who are doing the work, and we can just be in the struggle together again with the same purpose. So, So when I was invited, because I know Andrea did hers last time, and I was kind of like jumping in there. So when I was invited, like, hey, share your PDSA experience, I have to admit, I was kind of like still floundering and just like throwing words like, yeah, work processes. Yeah, that I know we need to do something around that. We need to fix that, you know? And so that was like my chosen word, work processes and flows and and then, you know, thinking about it a little bit more, I had kind of, I guess I was ahead of the game, Eva, I'm going to say, because my staff who I had talked about last meeting, she caught what I threw in the universe and had started working on organizing her work. So we had discussed it before, but we hadn't put it in PDSA prettiness. It was more of just a discussion, like we need to really get these workflows. We need to contact these people in a timely manner. So my chosen thing was just making sure that we engage quickly with members who are referred to us so that we can be able to assess whether they are people that will accept services, will quickly engage with the services, and we can have an ongoing active list so that we either quickly disenroll them if it's someone that we can't reach or someone who doesn't want the type of service we're offering, or we can know when to quickly get to them and offer them the services, you know, kind of thing. So we, as we were starting up, like I said, I have only one staff covering both counties. And so it was kind of for her balancing this thing of trying to catch up with folks. And, you know, you get caught up in one client, you forget to catch up, call that other one again to see if they are picking up the phone this time, or, you know, that kind of thing. And so we were really being lead-footed and not quick on our feet about following up with our clients and making sure that we have those processes, making sure that we're documenting so that we can bill. You know, these things were all part of what was affecting it. But what I had narrowed it down to was that I needed to talk to my staff about how she was managing her time so that she wasn't getting overwhelmed with the things that I needed to manage at the big picture level. So I need her to do what she needs to do most efficiently so we can knock off the unnecessary things and focus on the people that need the services. So all that said, so like I said, my focus was the workflow processes. So I had kind of focused on timelines, but in my discussions with her, what we figured out is that we really needed to focus on her caseload management. And so my PDSA has changed just a little bit. I think it still impacts timelines, and I guess that's where I can get feedback from everyone here about whether I'm talking about two different things, because I'm not clear if I'm talking about two different things on a PDSA or if I'm still talking about the same thing. So the overall picture was to quickly get clients served, to quickly recognize who needs services. But when I was talking with my staff, Marcy, what we figured out is really it was about what she needs to be efficient. And so we had created a kind of like a contact sheet, because she's a visual person like I am. So she needed something hard copy. It couldn't just be in the computer, and she needs something that she can check off manually. So she had created this document with her contact efforts, with her contact attempts and stuff like that, and the names of all the clients, and that she can check off with each attempt. And what that did is, before she started this sheet, her turnaround time for initial engagement, meaning she's received the referral and now she needs to make contact, was 1 week. But since she's been using the sheet, which has been over the last few weeks, her turnaround time is 1 day. So that's even better than my goal of 2 days, right? Yes, I was also very excited when I got, but so because my goal had been like 48 hours, reach them within 48 hours of getting the referral. As soon as you see that email with the new name on it, call them within 2 days. But what she found worked better for her was to, as soon as she saw that I had that number, to pick up that phone immediately and make that. So her turnaround time was much faster than even the goal. And it's been working for her. So, so when I was talking with her, I was like, okay, so you're seeing that this sheet that you can actually physically check off on, and you're seeing that this turnaround time for you of making the call instantly engaging is working for you. From May to June, when you really started actively using it, what would you say is your percentage? It's like, if you want me to throw a number out there, I'll say that my engagement has increased, my consistent engagement has increased by 89%. So of course we'd have to do math to see how that works, but that was good because she was feeling very confident. She is feeling very confident that she is now able to manage her caseload better. She's able to make the contacts she needs to make. She's contacting everyone consistently. And also it allows me on the other end to be able to say, okay, you've done your due diligence there, let them go. And let's move on to someone else who needs the service. So we are in the middle, I guess, of our due, but I kind of feel like we're in the middle of our study due, but we already kind of have an idea that this is working. So now the next step is where I guess I'm kind of like, okay, this is a best practice for her. This is working. And, do we just go on to the next question or the next thing we want to look at, or do we kind of examine this for a minute? So that's where I'm at, guys.
Yeah, Samantha, thank you so much for sharing your experience and highlighting that win. That's really exciting. And I would say absolutely you are in the study aspect of it, right? I mean, because you're in that phase of, okay, we're doing it, and now what are we noticing coming out of it? And so we're noticing that our turnaround time has gone from a week to a day, which from a member experience standpoint is a huge improvement in terms of member experience, right? But it sounds like you're also noticing that her confidence is higher and she's feeling better, which, we've talked on these calls about all of the challenges that staff face in these roles, and that retention is hard and burnout is hard. And so, the fact that that's another positive outcome that's coming out of this process change, I think that's really great. And absolutely, those are the things that you're noticing in that study portion. And then, you can choose whether to keep messing with that. Are there tweaks we want to make to her checklist, or are there ways, other things we want to do, or do we feel like we pretty much solved this one and we're on to the next? And I also, just want to highlight the process change that you made was relatively simple, right? You didn't need some massive new IT system or like some new, and sometimes that's what we need in order to improve a process. But sometimes it can be something, as quote unquote simple, but hugely impactful as what you're describing. So yeah, thank you. That's really exciting. I'm wondering if others on the call have any thoughts or questions or recommendations for Samantha and her team. Don't be shy.
Hey everyone, Alexis Taylor, one of the senior program managers here at Health Begins. I just want to re-applaud Samantha. I mean, I really wish that you saw my face like on the back end. I know that we're screen sharing at the moment. Next time we'll make sure to literally just have you front and center in the recording. You will be there, but I sat in on the office hours in which you participated in a couple of weeks ago. And I remember like the issues that you were flagging and how you were hoping to leverage like the PDSA tool, like as like an instrument to be able to like mediate those challenges. Right. And so I just, number one, like applaud like the progress that you all have been able to make, because double downing on what Gabrielle uplifted, CalAIM is a lot. Right. And I know that you stated like you went from working in a silo to having this coordination to feeling like you were back in a silo and really needing this partnership and like that collaboration in order to like establish those workflows. And I really appreciate like all of the effort that every single person like in this collaborative has been putting forward to be able to like identify those issues and then work with us like on that solutioning. Like there's so much to be proud of. And then also just to back up one more step, all of the issues that you all have flagged, those pain points that you all have flagged, I can't tell you how much we were jumping for joy and just so excited that you were able to provide so much information that DHCS was able to synthesize and then say, hey, we need to respond to this as quickly as possible. We need to develop an action plan as quickly as possible. And I also just wanted to re-uplift that we want to continue hearing like your progress on those PDSAs, so that way we can chronicle those best practices and once again, break down those silos. So that way everyone can have access to these tools and resources to streamline like their program delivery. And in addition to continuing to uplift those pain points and uplifting these best practices, we just want to reemphasize that what we uplifted during January when we launched its collaborative, this is all for the purpose of making like the provider experience so much easier, right? And so we'll, have those updates in July that Gabrielle flagged about those like statewide policy changes that are going to support that program delivery as well. But just so excited, just truly geeking out, and so just motivated for like what's to come next, like based off of these like early spotlights that we've been experiencing.
Great, thanks, Alexis. Well, I think that's actually a really good segue into our next slide. I'll turn it over to you, because Samantha very much took advantage of office hours. I think we spent almost an hour together and we're able to get through a lot of the nitty gritty on process change. So I'll turn it over to you.
Thank you. And thank you so much, Samantha, for sharing your experience going through this process. It's been really exciting to watch and great to see all of the progress that you all have made. But as Gabrielle mentioned, we had a great conversation with Samantha in office hours, which are a resource that are available to all of you monthly for support with your PDSA, any other kind of areas that you might need our support going through this process. So you can join us for office hours. The next 2 office hours are listed here. They're on Wednesday, July 5th, 2 to 3 p.m. and then Tuesday, August 1st, 2 to 3 p.m. The Zoom link is here, and I'll also follow up with all of that information. And also, if you would prefer to set up a one-on-one with our team, please feel free to reach out to me, and we'll be sure to set up a time that works for all of us, and we can kind of see how we can provide some additional support to you all. And just wanted to touch on also some of the kind of different topics that we've discussed during office hours. It doesn't have to be, specifically related to something that, we've talked about in this group, but it can be anything that sort of comes up while you're developing your PDSA. So we've done, just kind of like a relative CPI overview for some folks, touching on kind of recaps of previous sessions if you had to miss one. We can go through more in-depth, like your specific PDSA cycle, and sort of thought partner with you on developing that. We've discussed staffing and retention, management techniques, internal processes. So we're really just here to, support you where you are and help you move forward in this process. I see, Samantha, that you have your hand up.
So I happen to be in Reading, so I'm stealing a moment of time because I just want to show Marcy's beautiful face, who is my only staff who's doing this battle. So I just happen to be here, and I just want to recognize her. So because she may come knocking at some of y'all's doors.
Yes. Hi. Nice to meet you all.
Thanks, Marcy.
Great presentation.
So thank you for letting me have that moment, you guys. She's my soldier out here.
Thank you, Samantha. And now we're gonna go into part 3, implementation, and I'm gonna pass it back over to Gabrielle. Oh, sorry, see, Carolyn, you have your hand up.
I do. A quick question for Samantha, because when I attempted to look up the Lutheran support services, I could not find a location in Reading. Would you be kind enough to put your location in the chat and how we can connect with you?
Oh, absolutely. I will. Thank you.
Thank you, Carolyn. That's wonderful. Yeah, the more that the more that as providers we can rely on each other for, as Samantha was saying, sharing best practices, sharing ideas, what's working, what's not working. That's very much a part of the purpose of this collaborative. So great. All right, well, let's dive deep here into implementation, which is the bulk of what we're going to be spending the rest of our time together on. So we wanted to first we're going to introduce a tool that we've talked about a little bit at the last session, which is journey mapping. And so wanted to give you a kind of overview of what are journey maps, what do they look like, how might you be able to use them, not just in this work, but in any work that you do. So we'll do kind of a presentation around a tool, around the, journey mapping as a tool. And then in our breakout sessions, we're going to dive really deep in looking at specific journey maps, either for those of you that are already contracted with partnership, going through your journey of providing services and getting authorized for services and getting reimbursed for services. And for those of you that are in the contracting process or that are not yet contracted, we'll have a separate group for you to do the same exercise, but around the contracting process. So that's kind of what you can expect from the rest of our hour together. So let's go forward. If you could take us to one more. There we go. All right. So I like to think of journey maps as sort of like faces, in that we all have very different ones. They can look very different. They can look a lot of beautiful ways. But they all have fundamentally the same attributes. And ultimately, what a journey map is it's a way to visualize the steps that somebody is taking in a process. So essentially, you're outlining the steps, and then you can add on to that different layers depending on what your purpose is in doing that. So, and again, we'll look at some examples, but essentially you're outlining the process kind of start to finish of the process, of, the steps in a process. You are centering around a given experience. So in the ones that we're going to look at, we're centering around the experience of an ECM provider. You could also do a journey map. People often do them around clients or members or customers, whatever word you want to use, to try to get a sense of, well, okay, we know what our process is in terms of how we do the things, but what is the member's experience, or what is our client's experience of that? Because that can be really different than the intended experience we're trying to create. And it kind of can help distill out the experience of a client or a member separate from all of the machinations that happen in an organization behind the scenes. So in the journey maps that we're going to run through together, we will use members, and you'll see there'll be images and things. We're going to use members to remind ourselves who it is that we're here to serve, because we don't want to lose track of that. But I want to be clear that what we're not actually doing is mapping the member's experience. And I'll talk about that a little bit more, but we're really mapping what is the experience of an ECM provider as they go, who's already contracted with a managed care plan, and how do they go through the various steps of doing outreach, getting authorized, rendering service, and getting claims paid. The last thing, so again, we're going to outline, every journey map is outlining steps. It's always centering around one specific character's experience or type of person's experience. But the real juice of it happens in the layering. And you'll see some examples of this, but if we want to understand, for example, where there might be gaps between handoffs, we can layer in, okay, here in the process, here are all the places where a member is getting handed off from person A to person B. and then person B to person C, person C to person D, and you can map that out and then really easily have a visual to say, okay, now we know where are all the places that somebody could potentially fall through the cracks, and what do we need to do to bolster each of those, right? That's just an example. But so it can be a really helpful visual tool. So I really encourage you to play with this concept. Similar to the PDSA, there's nothing magic about it, right? Samantha was like, I was intending to do a PDSA, then I realized I was maybe already doing one. Right? These are just tools. And so you can use them as they relate to ECM. You can also use them as they relate to other things that your organization is involved in. So let's go to the next slide, Eva. All right, so here we have a journey map, and do not worry about all of the content. So here we have, I just want to kind of point out the pieces of this skeleton that we're looking at. So this is an example of a journey map. We have Sophia and her picture in the right-hand corner. She is a Medi-Cal member and a potential ECM client. And again, we put that there, not because it's her journey, but just to always remind ourselves why we're here and who we're serving. So then you have your numbers across the top from 1 to 6. These are kind of the phases of the process, and below them you have the titles. So first the member is going to get referred, then the ECM provider is going to do some outreach. They're maybe going to enroll the member. If they get enrolled, they're going to submit an auth and get the response back from the managed care plan on the authorization. Assuming it gets approved, the ECM provider is going to render that service, and then they're going to submit a claim and get that claim paid, right? So just kind of start to finish, what's the process that we're talking about? In this example, you have a lot of the detail, or you have some level of detail related to each of those phases. So for example, in the first one, under member referred, we have Sophia's identified by the plan through a self-referral or a provider. So that gives us some insight into, how that's starting out. And her member profile, like her member file is created. And then we have these arrows to kind of show in the process flow how she might move through that, or how the ECM provider might move through that, right? So this can be useful. Now let's see what that exact same process looks like, but just in a little bit different view. So let's do next slide. So here, now we only have phases 1 through 4 because all 6 didn't fit on the slide in a pretty way. But here we have less of the detail. So we've stripped away a lot of that detail, and we've also stripped away a lot of the arrows. I mean, we still have a little bit so you can kind of see the flow, but this one hopefully looks a little less daunting. And here we've really grounded in more the visual component, where we have pictures of each piece. So first, you see there Sophia is in her chair, then you see her ECM provider making that outreach call. Maybe she doesn't connect with her, which is down below, or maybe she does. And then you have, that conversation. Then you're moving over to enrollment, where now Sophia is talking with a different person. So this is an interesting point, right? Is the same person who is talking with Sophia originally, is that the same person who ends up being her case manager, or is that different? And that's going to depend on the organization. But that's an important piece in terms of her experience of it, right? And then you're moving through into the authorization phase. The other layer that we've added here is data exchange. So you see those little icons that look like a tablet and then 2 little hands. Each of those is a place where Sophia's data is getting sent to or from the ECM provider and the plan, the managed care plan. And so that's a helpful layer, because then if we do that, then we can say, okay, are there places where the data exchange is not happening correctly or consistently, or, we can kind of more easily visualize where in this process we might have some data exchange problems. Or are there places where it's working okay, but it could be streamlined? So again, this is just a visual tool to be able to align, especially if you have a bunch of different stakeholders, being able to say, okay, let's make sure we're all looking at the same thing and understanding, in this example, where in the ECM provider's journey the data is getting exchanged and at what points. So then we have a third example. And again, this is just to give you a sense that just like the faces, there can be many flavors of this. These can look a lot of different ways. Let's see, can we do next slide, please? Thank you. So here we've kept that same skeleton. So we have the same numbers and the same phases at the top. And to orient ourselves, we've included the same pictures. But here, the layer that we're really interested in, and this is actually the one that we're going to spend more time on today for the contracted group, are what we call the pain points. So the pain points is basically any issue or problem along the journey. And one of the layers that you can add to journey mapping is emotions. So you can ask people here's the map, put for each of these, what emotion comes up for you. And so I like to think of it in terms of, if you think about a phase in the process and you immediately are overwhelmed or frustrated or oh geez, that's so confusing. That part is so confusing. I don't even want to think about that. That's a pain point, right? So, if you're more of an emotions person, you can use that as a tune into your own emotional state. And if you think about the auth process and you immediately are oh, that's a pain point. So pay attention to that because that gives us information, right? That's data, that's information telling you there's something sticky going on there. And if we identify it, then we can move toward finding solutions for it. So in this third example, we've listed out in red below each of the pictures. So in each of the phases, the various pain points that we've heard across collaboratives. So not necessarily in this one. Some of them are things that you all have brought up in this collaborative. Some are ones that we've heard across the state. But just as a starting point, we wanted to list out what are all of the pain points that we've heard for each one. And what we're going to actually spend most of today on is going through those one by one. And I am so grateful that we have our partnership partners on the line here, because then we can start to really get into the meat of all of this, which is finding solutions, right? So the last point I will make on this is just coming back to that, again, while we have pictures of Sophia and we want to, really ground ourselves in with the reminder that we are here to serve Sophia and she needs to be front and center in the work that we do. This is actually not a map of her journey. If we were doing a map of a member's experience, it would be grounded in the lens, in Sophia's lens. So it might start, for example, with her getting that initial outreach call. So you might even start, whereas this one, it's, calls it number 2, outreach. For her, that might actually be step 1, because that's the first step in her experience. So if people are interested, we can certainly do more on member journey mapping. But for now, we're really trying to, what are the pain points in the provider journey for you all? And then how do we work all together and with the managed care plans to find some solutions to these sticky issues. So I will stop there and see if there are any questions, comments, and then if not, we're gonna go into our breakout groups. So any questions or anything coming up as we go through this? And feel free to use the chat or raise a hand or shout out, whatever you're most comfortable with. Okay. Well, in that case, I think we will go to our breakout rooms. Let's find some solutions. All right. So you can choose whether to go into, you'll get a pop-up and choose whether to take you into breakout room A is for organizations that are already contracted with partnership. Breakout room B is for those of you that are in the contracting process or are not yet contracted or are thinking about it. That's going to be your group. For Ashley and Chloe, if you want to kind of divide up and maybe each go to one, then that way we would have partnership representation in each group. That would be really lovely. And if you need any help, thank you. If you need any help figuring out the mechanics of any of this or which group you should go in, please put it in the chat and we will help you with that. Hello, everyone.
Hey, party people.
Well,
literally
we only got through a fraction of what we wanted to, but it was really great discussion on the ones that we did. So I think it was quality over quantity for our group.
Definitely.
Yeah. Ashlyn, how did things go on your side?
We had a wonderful TA focused session.
Nice. All right. All right. Important.
Yes.
Wonderful. All right. Well, as people are coming back here, we will move now into the last stage of everything here. And I think I will turn it over to Eva to take it away here.
Okay.
Yeah.
Thanks, Gabrielle. So we're going to move into some next steps. We are going to launch a quick poll to just see which of today's sections was most valuable. And I'll launch that right now. Give everyone a minute or two to just tell us kind of which section was the most helpful for you today. We'll give it a few more seconds just in case anyone else wants to share. All right, so I'm going to close that poll. And so it looks like today, the DHCS update and the discussion of pain points and solutions was the most valuable. So thank you for sharing. That'll help us moving forward, making sure that we're continuing to provide like the most valuable content. So prefacing session 7, which is the next session, continue working on your PDSA. If you haven't already, try out a test of change for the do portion or move on to the study portion, wherever you are in that process, by examining the impacts of your change. And some questions to consider are you getting the results you hoped for? Why or why not? And are there any impacts that you didn't expect, either bad or good? As we mentioned before, please feel free to reach out to us for any one-on-one support. We're here to, support with this process. So please feel free to send me an email and we'll get that set up for anyone who's interested. And please make sure that you're stopping by office hours if you have any questions. I will be sending those out in a Google Calendar invite, so they're on your calendar, and they'll also be included in any kind of follow-up outreach that you receive from me as well. And it'll be in this deck, so the Zoom link is linked there. We also have there's a PATH CPI participant experience survey, and in an ongoing effort to improve the CPI participant experience, DHCS and PCG are requesting the completion of this survey by June 30th. So please fill that out. It'll take about 15 minutes. If you participate in more than one CPI collaborative group, make sure that you're filling out a separate evaluation form for each collaborative. And all of your responses will be kept confidential and will be grouped in with kind of everyone's responses. And as always, we want to give a big thank you to the Health Begins project team, as well as Gabrielle Alt-Richer and the Gashow group for all of their support in continuing the CPI initiative and making these sessions really helpful and valuable for everyone involved. And thank you so much for joining us today. In this deck, we also have some additional resources for some events that are coming up, as well as contact information for partnership and additional documents and resources. And I will just pass it back to Gabrielle if you have any closing thoughts.
Yeah, no, just thank you so much. I think we got, I'm really excited to dive in more, continue doing that deep dive on pain points and solutions and use this space to really start to brainstorm solutions and share those. So thank you so much for spending this time with us and for sharing your ideas. Thank you also to Ashley and Chloe from Partnership for joining us today. Your participation is really, really appreciated. So great. Thank you all. Have a wonderful afternoon.
Bye, everyone.
Bye.
Thanks, everyone.